Welcome to RSSDI TV 2020. I am Dr. Sanjay Kamble, and on behalf of Wockhardt RSSDI TV 2020, I welcome you all. I am glad to have with us today Dr. Yousuf Khan. Dr. Khan is a consultant diabetologist at Dr. Yousuf's Healthcare Center and Magna Centers for Endocrinology, Hyderabad. Sir, based on your recent talk in RSSDI 2020, we would like to know, do all diabetic patients need insulin, and what are the benefits of timely insulin initiation?
Yeah, good morning. Yes, actually, all type 1 diabetic patients require insulin. And coming to type 2 diabetics, at some point of time, every patient requires insulin because diabetes is a progressive disease and the complications associated with diabetes also progress. So, timely and early insulin initiation gives the glycemic benefits in terms of HbA1c, fasting, and postprandial control to the patient. Thus, we can either prevent or at least slow down the diabetes related complications with the microvascular complications or macrovascular complications. And the same thing has been put forward by landmark trials like Wikipedia's that timely and early insulin initiation is the key in achieving long-term benefits for diabetic patients.
Thank you. So, what are the barriers to initiation of insulin therapy?
Yeah. Uh, See, we almost completed a century since the discovery of insulin, and so much of hard work went into the discovery. Great scientists put in the entire life for the discovery of insulin because that was a life-saving drug. Uh, and we have got newer insulins now and wonderful insulin devices which have made life easy and flexible for the patients. But unfortunately, still we are not able to give the benefit of insulin to the majority of patients on the right time. So there is definite delay or inertia in terms of insulin initiation, and the barrier could be doctor specific and also patient specific. Patient specific barrier, we call it the insulin distress. That is the emotional response of the patients when a doctor suggests insulin. So the patient has fear of hypoglycemia, that is sudden low sugars, fear of injection, weight gain. The patient feels that I need to take insulin permanently, so that creates anxiety, and it makes it less flexible as far as his day-to-day schedule is concerned. So all these factors add to the so-called insulin distress in the patient. Parallelly, there is negative feedback coming in from family and friends regarding insulin because of misleading information or phobia with regards to insulin. So all these factors augment the insulin distress. And coming to doctor specific barriers, yes, we need many clinicians, they lack knowledge, the experience and exposure to insulin therapy, especially the novel insulin therapy. And clinicians are also concerned about the risk of hypoglycemia and weight gain. And sometimes, retention of the patient itself is the priority. So the clinician doesn't want to lose the patient. So all these factors, whether it is doctor specific or patient specific, they cause the delay in insulin initiation.
Thank you,
Yeah.
sir. And so, how do we really overcome these barriers when we are initiating insulin therapy?
Yeah. So I think the barriers have been the same, whether it was 20, 30 years back or now, and the solution also is the same. Uh, what I feel is whenever we initiate insulin to a patient, the most important thing is we need to invest some time. Give an extra 10 minutes to the patient, educate the patient. You can take the help of the nutritionist or a diabetes educator at a center, and then explain the benefits of insulin to the patient, the right injection technique, how to inject and where to inject, how to store the device, and we need to explain the symptoms and signs of hypoglycemia, how to detect hypoglycemia, and how to treat it on time. And at the same time, we need to give personalized titration charts to the patient, make them understand active self monitoring at home, And I think the first 4 weeks after insulin initiation is very important, because we need to monitor the patient. We need to instill confidence in the patient. At least once in a week, we need to review the patient. And this first 1 month, if you're able to smoothly control the insulin and the sugar levels in the patient and titrate insulin appropriately, that will have a lot of confidence and trust in the patient, and he will be compliant, and thus we can achieve the glycemic targets which are desired, and that will provide long-term benefits to the patient in terms of prevention of diabetes associated complications. As far as the overcoming clinician barriers are concerned, definitely the CMEs, the conferences, workshops, updating oneself about novel insulins, about titration strategies, and we need to have a uniform guidelines for insulin initiation and continuation and up titration. So definitely we need to be students constantly, doctors, so that we can overcome these barriers and provide better lifestyle and flexibility to the patient.
Thank you, sir. So thank you so much for sharing your views, and stay tuned to RSSDI TV 2020 for more updates from RSSDI 2020. Thank you so much.
Thank you.